High blood pressure is called the silent killer for a reason. It damages your arteries, strains your heart, attacks your kidneys, and erodes your brain function for years, or even decades without producing a single symptom you can feel. By the time you notice something is wrong, the damage is often extensive and irreversible. More than 70% of adults over 65 have high blood pressure, and it is the single largest modifiable risk factor for heart attack, stroke, heart failure, kidney disease, and vascular dementia. Medications are important. If your doctor has prescribed blood pressure medication, take it faithfully. It saves lives. But what most people do not realize is that certain foods have been scientifically proven to lower blood pressure through mechanisms that complement and sometimes rival the effects of pharmaceutical drugs. These are not exotic supplements or expensive superfoods. They are simple, affordable, everyday foods that you can find in any grocery store. And adding them to your diet can produce measurable reductions in blood pressure within weeks. Today I'm going to share 5 specific foods that doctors and researchers have identified as powerful natural blood pressure reducers, explain the science behind how each one works, and tell you exactly how to incorporate them into your daily routine for maximum benefit. The first food that lowers blood pressure naturally is beets. Beets may be the single most powerful blood pressure lowering food in the entire human diet, and the science behind their effectiveness is remarkable. Beets are extraordinarily rich in dietary nitrates, natural compounds that your body converts into nitric oxide, a molecule that causes blood vessels to relax and dilate. When blood vessels dilate, the resistance to blood flow decreases and blood pressure drops. It is the same mechanism by which nitroglycerin, one of the oldest and most effective cardiac medications, works to relieve chest pain and lower blood pressure. The research on beets and blood pressure is extensive and compelling. A landmark study published in the journal Hypertension found that drinking just 1 cup of beetroot juice lowered systolic blood pressure by an average of 10 millimeters of mercury within 3 hours. That is comparable to the effect of many prescription blood pressure medications. A meta-analysis of 16 clinical trials published in the Journal of Nutrition confirmed that beetroot juice supplementation produces significant reductions in both systolic and diastolic blood pressure. With the effects being most pronounced in individuals with existing hypertension. The blood pressure reduction from beets peaks at about 3 to 6 hours after consumption and can persist for up to 24 hours. This means that a daily serving of beets, whether eaten roasted, blended into a smoothie, or consumed as juice, can provide sustained blood pressure support throughout the day. The most effective way to incorporate beets into your routine is through beetroot juice, which provides a concentrated dose of dietary nitrates. Start with half a cup daily and increase to 1 cup as tolerated. If you prefer whole beets, roasting them preserves most of their nitrate content. Boiling beets causes significant nitrate loss into the cooking water, so if you boil them, save and drink the cooking liquid. Pickled beets retain some nitrate but also contain significant sodium, which can counteract the blood pressure benefit, so fresh or roasted beets are preferable. One important note, if you take blood pressure medication, adding beets to your diet may cause your blood pressure to drop too low. Monitor your blood pressure at home when you begin incorporating beets, and inform your doctor so they can adjust your medication dosage if necessary. This is actually good news. It means the beets are working. The second food that lowers blood pressure naturally is bananas. Bananas are one of the best dietary sources of potassium, providing approximately 420 milligrams per medium banana. Potassium is the most important mineral for blood pressure regulation, and most Americans consume far less than the recommended daily intake of approximately 3,400 milligrams for women and 4,700 milligrams for men. Potassium lowers blood pressure through 2 complementary mechanisms. First, it promotes sodium excretion by the kidneys. Sodium and potassium work in opposition. When potassium levels rise, the kidneys excrete more sodium and water, reducing blood volume and lowering blood pressure. This is why increasing potassium intake can be as effective as reducing sodium intake for blood pressure management. Second, potassium directly relaxes the walls of blood vessels, reducing vascular resistance and allowing blood to flow more freely. A major meta-analysis published in the Journal of the American College of Cardiology analyzed data from 33 randomized controlled trials and found that increased potassium intake reduced systolic blood pressure by an average of 3.5 millimeters of mercury and diastolic blood pressure by 2 millimeters of mercury in adults with hypertension. While these numbers may seem modest individually, at the population level, they translate into significant reductions in heart attack and stroke risk. Eating 1 to 2 bananas daily is an easy, practical way to boost your potassium intake. They require no preparation, they are portable, they are inexpensive year-round, and they combine well with other blood pressure-lowering foods. A morning smoothie with a banana and half a cup of beetroot juice, for example, provides both potassium and dietary nitrates, a powerful 1-2 punch for blood pressure reduction. One caution for seniors with kidney disease. Impaired kidneys cannot excrete excess potassium efficiently, and high potassium intake can cause dangerous elevations in blood potassium levels that affect heart rhythm. If you have been diagnosed with chronic kidney disease, or if your doctor has told you to limit potassium, consult with your physician before significantly increasing your banana or potassium intake. The third food that lowers blood pressure naturally is leafy green vegetables, specifically spinach, kale, Swiss chard, and arugula. Leafy greens are a triple threat against high blood pressure. They are rich in potassium, which promotes sodium excretion and vasodilation. They are excellent sources of magnesium, which relaxes blood vessel walls and reduces vascular resistance. And like beets, many leafy greens, particularly arugula and spinach, are high in dietary nitrates that the body converts to blood pressure-lowering nitric oxide. The DASH diet, dietary approaches to stop hypertension, which was developed specifically to lower blood pressure through dietary modification, places leafy green vegetables at the centre of its recommendations. The DASH diet has been shown in multiple large clinical trials to lower systolic blood pressure by 8 to 14 millimeters of mercury, a reduction comparable to adding a blood pressure medication. And the benefits are seen within just 2 weeks of adopting the dietary pattern. Incorporating leafy greens into your daily diet is simpler than most people think. A large handful of spinach added to a morning smoothie is virtually tasteless, but provides significant potassium, magnesium, and nitrates. A side salad with lunch or dinner takes minutes to prepare. Sauteed kale or Swiss chard with garlic and olive oil makes a delicious and highly nutritious side dish. And arugula, which has the highest nitrate content of any commonly available leafy green, adds a peppery flavour to sandwiches, salads, and grain bowls. Aim for at least 1 to 2 servings of leafy greens daily. A serving is approximately 1 cup raw or half a cup cooked. The more consistently you consume them, the more sustained the blood pressure benefit. The fourth food that lowers blood pressure naturally is oats. Oats, specifically whole oats and oatmeal, have been the subject of extensive research on blood pressure and cardiovascular health, and the results consistently demonstrate significant benefit. The primary mechanism involves a type of soluble fibre called beta-glucan, which forms a gel-like substance in the digestive tract that slows the absorption of sugar and cholesterol and modulates the release of vasoactive substances that influence blood pressure. A meta-analysis published in the Journal of Hypertension examined data from 18 clinical trials and found that oat consumption reduced systolic blood pressure by an average of 2.7 millimeters of mercury and diastolic pressure by 1.5 millimeters of mercury. These reductions were most pronounced in individuals who consumed at least 3 grams of beta-glucan daily, the amount found in approximately 1.5 cups of cooked oatmeal. Beyond beta-glucan, oats provide magnesium, potassium, and unique antioxidant compounds called avenanthramides that have been shown to increase nitric oxide production and reduce inflammation in blood vessel walls. Avenanthramides are found almost exclusively in oats and contribute to their cardiovascular benefits in ways that other grains cannot match. The best way to incorporate oats is through a daily bowl of oatmeal, preferably steel-cut or rolled oats rather than instant oatmeal, which is more processed and often contains added sugar and sodium. Top your oatmeal with sliced banana for additional potassium, a handful of berries for antioxidant polyphenols, and a sprinkle of ground flaxseed for omega-3 fatty acids. This combination creates a breakfast that addresses multiple blood pressure pathways simultaneously. The fifth food that lowers blood pressure naturally is fatty fish, specifically salmon, mackerel, sardines, and herring. Fatty fish are the richest dietary source of omega-3 fatty acids, eicosapentaenoic acid and docosahexaenoic acid, which have been extensively studied for their cardiovascular benefits. Omega-3 fatty acids lower blood pressure through several mechanisms. They reduce the production of inflammatory compounds called eicosanoids that constrict blood vessels. They improve endothelial function by increasing nitric oxide bioavailability. They reduce arterial stiffness by improving the elasticity of blood vessel walls. And they lower heart rate by modulating autonomic nervous system activity. A comprehensive meta-analysis published in the American Journal of Hypertension analyzed data from 70 randomized controlled trials involving nearly 5,000 participants and found that omega-3 fatty acid supplementation reduced systolic blood pressure by an average of 4.5 millimeters of mercury and diastolic pressure by 3 millimeters of mercury in individuals with hypertension. These reductions are clinically meaningful and comparable to those achieved by some first-line blood pressure medications. The American Heart Association recommends consuming fatty fish at least twice per week for cardiovascular health. A serving is approximately 3.5 ounces, roughly the size of a deck of cards. Salmon is the most widely available and versatile option, and it can be baked, grilled, poached, or added to salads and grain bowls. Canned sardines are an economical alternative that provides comparable omega-3 content, along with calcium from the edible bones. Mackerel and herring are excellent choices that are often available smoked or canned. Mercury content is a concern with some fish, particularly large predatory species like shark, swordfish, king mackerel, and tilefish. However, the fish I recommend, salmon, sardines, herring, and Atlantic mackerel, are relatively low in mercury and safe for regular consumption. The cardiovascular benefits of eating these fish far outweigh any mercury-related risk for most adults. Now let me connect all 5 foods with a practical daily eating plan that incorporates them naturally into your routine. Start your morning with a bowl of oatmeal, topped with a sliced banana and a handful of blueberries. This provides beta-glucan fiber, potassium, and antioxidant polyphenols, 3 blood pressure-lowering compounds in a single meal. Alongside your oatmeal, drink half a cup of beetroot juice for a concentrated dose of dietary nitrates that will lower blood pressure throughout the morning. For lunch, build a large salad with a base of arugula and spinach, the highest nitrate leafy greens, topped with vegetables, olive oil, and lemon dressing. Add a can of sardines or leftover salmon for omega-3 fatty acids and protein. This meal hits 4 of the 5 food categories in a single sitting. For dinner, prepare a baked or grilled salmon fillet, served with a side of sautéed Swiss chard or kale. This provides another serving of omega-3 fatty acids and leafy greens. Keep the meal moderate in sodium by seasoning with herbs, garlic, lemon, and spices rather than salt. This eating pattern does not require dramatic dietary overhaul or exotic ingredients. It uses simple, affordable foods available at any supermarket, and it creates a synergistic blood pressure lowering effect that addresses multiple physiological pathways simultaneously: nitric oxide production, potassium-sodium balance, omega-3 anti-inflammatory effects, and beta-glucan fiber modulation. Consistency is the key to dietary blood pressure management. Eating these foods once in a while will not produce meaningful results. Eating them daily, making them a permanent part of your routine, is what produces the sustained blood pressure reductions documented in clinical trials. Give yourself at least 4 to 6 weeks of consistent daily consumption before evaluating the results, and monitor your blood pressure at home to track your progress. If you are taking blood pressure medication, do not stop or reduce your medication based on dietary changes alone. Work with your doctor, monitor your pressure, and let them adjust your medication if the dietary improvements warrant it. The goal is to complement medical treatment with dietary support, not to replace one with the other. Share this with every senior you know who's living with high blood pressure. These 5 foods, beets, bananas, leafy greens, oats, and fatty fish, are among the most powerful natural blood pressure reducers available, and they are accessible to virtually everyone. Subscribe for more evidence-based health content, and drop a comment below telling me which of these foods you already eat and which ones you plan to add. Your engagement helps this community grow, and I read every single one. Feed your body the right foods, and your blood pressure will respond. It is that simple. and it is that powerful. Dark chocolate deserves honourable mention as a blood pressure-friendly food that may surprise many readers. Cocoa contains high concentrations of polyphenolic compounds called flavonols that stimulate nitric oxide production in the endothelial cells lining blood vessels. A meta-analysis published in the BMC Medicine Journal analysed data from 20 clinical trials and found that dark chocolate and cocoa products produce statistically significant reductions in blood pressure, with average decreases of approximately 2 to 3 millimeters of mercury in systolic pressure. The key is choosing dark chocolate with at least 70% cocoa content and consuming it in moderation, approximately 1 to 2 small squares per day. Milk chocolate and white chocolate do not provide the same benefit because they contain much lower concentrations of flavonols and much higher concentrations of sugar and fat. Dark chocolate should be viewed as a supplementary treat that provides modest blood pressure support, not as a primary intervention like the 5 main foods I discussed. Garlic has been used as a medicinal food for thousands of years, and modern research has validated many of its cardiovascular benefits. Garlic contains allicin and other organosulfur compounds that promote nitric oxide synthesis, inhibit angiotensin-converting enzyme activity, and reduce arterial stiffness. A comprehensive meta-analysis published in the Journal of Clinical Hypertension examined data from 12 clinical trials and found that garlic supplementation reduced systolic blood pressure by an average of 8.3 millimeters of mercury in diastolic pressure by 5.5 millimeters of mercury in hypertensive patients. These reductions are comparable to those achieved by some first-line antihypertensive medications. Fresh garlic is the most potent form. Crushing or chopping the cloves activates the enzyme alliinase, which converts alliin into the bioactive compound allicin. Allowing crushed garlic to sit for 10 minutes before cooking maximizes allicin production. Aged garlic extract supplements are an alternative for those who find fresh garlic difficult to consume regularly. The synergistic effect of combining multiple blood pressure-lowering foods cannot be overstated. The DASH diet, which incorporates many of the foods I've described along with reduced sodium intake, low-fat dairy products and limited processed foods, produces blood pressure reductions of 8 to 14 millimeters of mercury, reductions that exceed the effect of any single food consumed in isolation. This synergy occurs because different foods target different physiological pathways simultaneously. Beets increase nitric oxide production, bananas enhance renal sodium excretion. Leafy greens provide magnesium for vascular relaxation. Oats modulate cholesterol and arterial inflammation, and fatty fish reduce systemic inflammation and improve endothelial function. When these mechanisms operate in concert, their combined effect is greater than the sum of their individual contributions. This is why dietary pattern changes produce larger blood pressure reductions than supplementation with isolated nutrients. The whole food approach captures synergies that pill-based approaches cannot replicate. Pomegranate juice is another evidence-based blood pressure-lowering beverage that seniors should consider adding to their routine. Pomegranate juice is exceptionally rich in polyphenolic antioxidants, particularly punicalagins and ellagic acid, that have been shown to reduce oxidative stress in blood vessel walls, inhibit angiotensin-converting enzyme activity, and improve endothelial function. A meta-analysis published in Pharmacological Research examined data from 8 randomized controlled trials and found that pomegranate juice consumption produced significant reductions in both systolic and diastolic blood pressure, regardless of the dose or duration of consumption. The effects were most pronounced in individuals with existing hypertension. A practical serving of approximately 1 cup of pomegranate juice daily provides the polyphenol concentration used in most clinical studies. Choose pure pomegranate juice without added sugars, and be aware that pomegranate juice can interact with certain medications, particularly statins and blood thinners. So discuss with your doctor before adding it to your routine. Sodium reduction is the dietary counterpart to potassium increase, and the two strategies work synergistically to lower blood pressure. The average American diet contains approximately 3,400 milligrams of sodium per day, more than double the 1,500 milligrams recommended by the American Heart Association for optimal cardiovascular health. The majority of this excess sodium comes not from the salt shaker, but from processed, packaged, and restaurant foods. Bread, deli meats, canned soups, frozen meals, condiments, and fast food are among the most sodium-dense items in the typical diet. Reducing sodium intake by even 500 milligrams per day has been shown to produce measurable blood pressure reductions, and the benefits compound when sodium reduction is combined with increased intake of the potassium-rich, nitrate-rich, and omega-3-rich foods I described. Reading nutrition labels, choosing low-sodium versions of pantry staples, cooking more meals at home with fresh ingredients, and using herbs and spices rather than salt for flavouring are practical strategies that can dramatically reduce sodium intake without sacrificing taste or enjoyment. Physical activity amplifies the blood pressure lowering effects of dietary interventions in ways that make the combination more powerful than either approach alone. Regular aerobic exercise, walking, swimming, cycling, or any activity that elevates heart rate for sustained periods, lowers blood pressure through multiple mechanisms including improved endothelial function, reduced arterial stiffness, decreased sympathetic nervous system activity, enhanced renal sodium excretion, and reduced body weight. The blood pressure reduction from regular exercise averages 5 to 8 millimeters of mercury, and this reduction is additive with dietary improvements. A senior who adopts the DASH eating pattern and begins a regular walking program can achieve combined blood pressure reductions of 15 to 20 millimeters of mercury, reductions that may allow medication dose reduction, or, in some cases, elimination of blood pressure medication entirely under medical supervision.